Hi, my name is Alexis Porter, and today I'll be talking with Ms. Jones about pregnancy prevention among college students 18 to 24.
Hello, I'm Belinda Jones, a faculty member here at North Carolina Central University. I have a master's in public health, and I teach some of the public health classes. And in some of our classes, we talk about contraception and pregnancy prevention. And there are various methods that can be used for contraceptives or pregnancy prevention. And so for college-age students, there is no reason anybody should get pregnant. You can go to the drugstore if you haven't gone to a doctor yet and buy several of the methods of contraception. The male condom, the female condom, vaginal contraceptive film, contraceptive cream, or foam. These methods can be bought at the drugstore, and the contraceptive sponge without a prescription. So you can use those until you go to a doctor to get a checkup and get some other kind of method. Then there's the methods that you do have to get a checkup with the doctor and get prescribed. There's the contraceptive pill, the implant, the Depo-Provera, which is a shot, the NuvaRing, which can be inserted into the vagina, pushed far back for 21 days, and it has chemicals that prevent pregnancy. There's the Mirena, which is an IUD, which has to be inserted by a doctor or nurse practitioner or physician assistant. And then there's also the diaphragm, which can be inserted, and you have to be measured for. They come in various sizes. There's also the cervical cap, which can be pushed far back into the vagina and up against the cervix to prevent pregnancy. So, as you can see, there are various methods that can be used for contraception or preventing pregnancy. In addition, the female condom, when we're talking about contraceptives that you have to go to a doctor and get a prescription for because they have hormones in them, one is the implants, hormonal implants that are inserted into the arm. It lasts somewhere around 3 years, and there are some that it lasts 5 years. Then Depo-Provera is a hormone that's injected, and it lasts 3 months. There's a new one called Lunel that lasts 1 month. The NuvaRing has hormones in it, and it is inserted into the vagina and pushed back over the cervix, and it lasts 21 days, and you take it out when it's time for the menstrual cycle to begin. And then the IUD, Mirena, lasts about 5 years, and it's inserted up into the uterus by the doctor or doctor, nurse practitioner, or physician assistant into the uterus, and it stays in there until they're able to take it out. However, it's not recommended for women who have not had children because the uterus can contract. And there's the dental dam and the flavored condoms that can be used for oral sex for females and males. So in addition to preventing pregnancy, some of these methods can also prevent sexually transmitted infections. It's very important for a person's future to think about using contraception and not having children until you're really ready. That it could interfere with your school, it could interfere with your life plan. It doesn't necessarily destroy it, but it can interfere with it and cause you to not be able to do the things you want to do immediately for success.